Health IQ, brought to you by Rolling Out in the Atlanta Fibroid Center. I'm Dr. John Lipman, founder and medical director of the Atlanta Fibroid Center, and tonight's episode is on nutrition and fibroids, and I'm really pleased to welcome another doctor on the panel and from Atlanta. I'll let you introduce yourself, but I really appreciate you taking your time and joining us tonight, Dr. Lauren Powell. Thanks for being with us.
Thanks, Dr. Lipman, so much for having me. And I'm not from Atlanta. I can't claim Atlanta as my home. I'm actually from Detroit, but Atlanta is home to a lot of transplants. I feel like Atlanta is home now.
Yeah, I've been here 31 years. I'm a common law Atlantan.
Yeah, we very rarely meet people from Atlanta these days. Every time I see a patient and they say they're from Atlanta, I was like, where are y'all at? Where do you guys live?
Yeah, that's true. So tell us about the Culinary Doctor. Give me the backstory. What's that all about? How did you become that?
Sure. So I'm a board certified family medicine physician. I really believe in the power of food. I believe it's one of the most powerful drugs that we have. And so my goal is to use food and to teach people about how to utilize food to prevent and cure diseases. And that kind of started for me when I was in residency. It was a ritual of mine that whenever I got off call, I would call my dad and he would keep me awake while I was driving home from call. And so one Saturday I called him, telling him about my overnight call and the patients that I had taken care of. And while we were on the phone, my dad's speech became very blurry. It was hard to understand him. And I recognized my dad was having a stroke on the phone. And so, we got him, all the medical care that he needed. His blood sugar was all over the place. His blood pressure was all over the place. His cholesterol was so high that it just said high, like we couldn't even get a number. And my dad was not a neglectful patient. He was going to the doctors every 3 months. He was taking all the pills and all the things, and he was doing what he was being told to do. And I mean, the same thing was happening to me. I was taking care of patients, telling them what to do in terms of medications and things like that. But then I was still taking care of them when they got admitted to the hospital for strokes and heart attacks and DKA and all these other things. So it just really shifted and kind of shook me up a little bit. Like, what does it mean if we ask our patients to do things and they do them and bad things still happens? Like, maybe there's a piece of it that we're missing. Maybe there's something that we're not telling them. And so for me, that's when I really started on this journey of learning about food, learning more about lifestyle, to really get to the root cause of diseases. And so that's kind of where I am. So I did some extra training through Tulane School of Medicine, and I've just been on a journey. I mean, like I know we don't get a lot of training in nutrition in medical school. So I've just been on a quest since I finished residency in 2017, just learning as much as I can and going to every food and health conference that I can, just so that I can be the best educator so that I can help my patients. Well,
that's great. I mean, we talked about this on a previous episode, how physicians, I mean, particularly specialists, you almost feel like you're a mechanic that, things happen to the car and the car breaks down and they come to me to fix the car. But it would really be helpful if I could get on the front end of things and educate people about the right fuel to use for your car, how to keep your car in good shape. And so not to have to break down so often and then come to me to fix it. They could, do it themselves, and preventive maintenance on the front end would go a long way. And, you hear quotes all the time about how 80% of disease is preventable, and there really does need to be more emphasis on the front end. So what are the kind of things you actually incorporate? You're not just the culinary doctor, you're a real doctor, a family physician. People are, and that's important to kind of re-emphasize, because some people may just tune in and say, well, there's the culinary doctor's on. Is that a real doctor? But you're a real doctor, and you're incorporating food into your medical practice, which is really unique. And I think it's fabulous. I think it's really, tell me about some of the things you talk about, just in general, like in women's health, for instance, and then we'll kind of direct it into fibroids.
Sure. So food is such a big topic and there's really so much to talk about. So, I mean, I do a lot of education in the office, but I do a lot beyond the office because we just don't have enough time. I mean, like I know how the medical care system is set up these days. It's just, it doesn't always give us the best environment to just do the deep dive. So I do a lot of online education like we're doing here. I actually have an online membership where this is all I talk about is just food and health. And I just teach and I do virtual cooking classes. And I just make the information applicable. I teach food principles and then I show you those principles in action, like with real food. So that's something that I'm super proud of in a way that I feel like I can really reach more people. Now, if you come and see me in the office and we're just kind of talking about your health, I'm always going to talk about, I always like to start with this general question, which is, what do you think about your diet? Like, how would you say? Would you say it's like good? Would you say it's bad? You need improvement? And people usually say, oh, it's okay. And I say, okay, let's talk about everything you ate and drank in the last 24 hours. And so that always helps because we can get some objective information about what people are eating, about what people are drinking. And I'll, make a couple of comments about that just in a general sense. And then after I have some more objective data, like their lab work, then I can go really, really deep and I can say, listen, we're pre-diabetic and this is what that means. And so this is what we need to do. Your blood pressure, it's been elevated. We need to talk about that. We need to talk about foods and drinks that you're consuming that are likely contributing to that. We have to talk about your sleep. We have to talk about the way that you're moving your body. We have to talk about the way that you're managing stress. So all those things are going to fit into, your health and how you're feeling. Sometimes people come in with that one complaint. They come in with this one concern, and it's really, we have to address all these other things, and then that's going to fix itself. And so that's kind of my approach.
You really do take time separate with the food component of it, like food journal. You asked about, like, do they like keep track of what they're doing, and do you see them changing the behavior, like they're picking up better ways to do things, and
oh yeah,
you're seeing that translate in their better lab data? Or
yes, and that's the best. And that's why I love, like, my passion is truly like, cardiometabolic health. I feel like it is important for everything. It's important for our women's health. It's important for our mental health. Of course, it's important for our heart health. So what I love about it is you can show people how when you do this, it really works. Like, it's not magic. It's not like, woo, like how, and it's not mystical. It's like, listen, if we remove certain things from our diet, we add these other things in, we start moving our body and do these other lifestyle things, you will feel better. And I will show you in your blood work that you are healthier. Like it's very, if you're willing to be committed and put in the work, I'm here. And I think a lot of times what patients also need is accountability. So they have to follow up with me closely. You have to follow with me closely because that's how I make sure that you're staying on track. And I mean, it takes a lot to make these changes. Like I know Dr. Lipman, it's easier just to take a pill and be done. Like that's the easier way. These lifestyle things are more difficult. They're more difficult for the patient to do. And so they need more guidance. They need more monitoring. They need more encouragement, and so regular follow-up is really important.
Yeah. I mean, so many times it's like the only thing we're really monitoring, at least, is like their pounds. How much do they weigh? I mean, we get that measurement, and, if they're a little bit more than they were last time, it's like, oh, try to eat better. Kind of, I mean, it's really vague. And
yeah. And honestly, I don't even do pounds, especially with women. I don't do pounds. With my men, I may do that, look at their weight, but women, I don't go by their weight. I go by their waist circumference because I care about that visceral fat. I care about that central adiposity. And so I'm going by, did the skinny jeans fit this week? Did they not fit this week? Did that dress, were you able to zip it? These things that you will see, the scale may be slower to change. And so sometimes if people are looking at that number, they can be discouraged and they can say, I'm doing all these things, but the numbers aren't dropping as fast as I want it to. And so I don't even want them to look at the scale because that may discourage them. I want them to trust the process. And so putting on those pants, zipping that dress, you'll feel it'll fit. And sometimes that happens before the pounds fall off.
Great. So that's kind of, I was wondering how you keep people compliant, because, medicines are hard to comply with. A lot of people don't want to take medicines. people get ingrained in their habits, whether it's how they eat or how they cook, or, they like the junk food or whatever. So the strategies to kind of keep them compliant, I guess, if their genes fit better, that's certainly something for women that would be a positive reinforcement. But keeping them compliant, I would imagine, is a challenge.
Yeah, and I think I'm a little bit different because oftentimes by the time people are coming to see me, they know that that's my approach, and they know that I'm very tough with my patients because this is their life, and a lot of times, I think sometimes doctors can be they're worried about being tough with patients because they don't want to, there's like, it's like this thin line. We want to obviously respect, we never want to shame patients, but I'm very tough with them. I let them know, if we do not change something bad is going to happen, and it's going to be too late.
Right.
So I keep it very real. I'm not trying to scare them, but I want to be honest, because so many times I'll see patients and, they have no idea, like their insight into, their current health and the negative consequences, they don't understand. And so it's my goal to make that very crystal clear and sharp. I use the analogy cigarette smoking. All of us know if you smoke cigarettes, the risk of developing lung cancer is there. That's very clear. And when we put the cigarette in our mouth, even if we decide to, we're doing it knowing that risk. But I think with food, people don't always understand the risk. And so I try to make that very crystal clear. If you continue to eat this way, this is what's going to happen. And I know you feel okay now, like you feel okay, but don't wait till you feel not okay to fix it, because it's too late then. It really may be too late.
Yes. Yeah. No. Do you incorporate other strategies? Yoga, meditation, stress relievers, obviously exercise. How do those fit in? Is it just part of the holistic?
Well, I like to give my patients, if there's someone that's not currently exercising, I like to get them in a supervised exercise program, because I don't want them hurting themselves. I don't want them just going to the gym and, doing things and they're not really maximizing their time because we're busy. Of course, I see a lot of women. And so women, we're busy. We have all these hats and these things that we're juggling. So I want them to maximize their time. So generally, I want them in some kind of structured, supervised exercise program. So I kind of, knowing the resources that I know, looking into what's in their area, I try to get them in something like that. And then, of course, I always talk about sleep, because sleep is so important to weight loss. It's so important to stress management. It's so important to blood pressure, blood sugar. I mean, it affects so many of our hormones. It affects our cycles, like I know. So we have to deal with sleep. A lot of women aren't sleeping, and they just think it's normal because they haven't slept in a decade. And so they just, they don't know that it's a problem or that we can do anything about it. So I always try to address sleep. And then, of course, stress management. There's a lot of resources now, especially with COVID, that became available for people to utilize mental health services. So I'm all about getting my patients at least to do some kind of talk therapy. Even if you think things are okay, it's just great to have an objective person, if you can, to just talk.
Sure. And I was reading about how obesity is a major risk factor for having severe COVID, even in young patients. I don't know, do you see any younger patients, or is it an adult practice only?
Well, I'm family medicine, so I see patients. I had a patient today who's 12 years old, but generally I'm seeing patients 16, and then my oldest patient is like 103. So I'm seeing kind of the whole range. And so, yes, the obesity, the diabetes, the hypertension. I'm diagnosing that in teenagers. I'm diagnosing it in teenagers. And so it's definitely something, again, we have to get aggressive about. We really have to get aggressive about it.
So shifting gears just a little bit and getting into fibroids, that's one of the things that got me interested in kind of nutritional aspect of stuff, is just that a number of patients really kind of bent the curve and improved their symptoms from fibroids with nutritional stuff and exercise and weight loss. So we started incorporating some of those things into our practice, and it really has helped a lot. So you see women with fibroids, I'm assuming, and is there an approach that you try with patients with fibroids, or is it part of just a general?
Well, definitely, if anyone has any kind of, menstrual disturbance, which is usually how I find out that they have fibroids, right? I'm asking them like, what are your cycles like? And they say, oh, I hemorrhage for 7 days. It feels like I'm dying. And that, that happens every month. And that's been happening for 10 years, and then I say, what, and then that's kind of when we discover what's going on, but really talking about alcohol use, because alcohol use has been, specifically beer consumption, has been associated with increased fibroid size. The red meats, really those inflammatory foods like the beef and the ham. I'm always trying to get my patients to kind of, minimize the red meats. Another thing that's super important, and I know you know about like the dose dependent benefit of vitamin D. And so I see oftentimes, I think 76% of African Americans are deficient in vitamin D, whereas like in the general population, I think it's like 40%. And vitamin D has been shown, like those who are deficient in vitamin D they were shown to have larger fibroids. And they've done rat studies where they've given these rats high dose vitamin D3 and how it shrunk their fibroids. So I'm always checking vitamin D on my patients at 16 years old, because it's amazing how I'll check their vitamin D and it'll be like 9, and generally we like it at least 35. But there's people walking around with 5, 9, like these single digit vitamin D levels. So I think that's important as well. And then of course, blood pressure. I don't know if you're about the link between the pathogenesis of blood pressure and fibroids, specifically that diastolic, that bottom number, and how an increase in that number, they've shown, they've seen this significant increased risk of fibroids, like people with like 10 millimeters more, I think, of mercury, like an 8 to 10% increased risk of fibroids. So being aggressive with blood pressure early, I think, is really important. And a lot of times the things that we're using to control blood pressure are the same things that are going to help with fibroids, or the same thing that's going to help with weight loss. It's those same things. Yeah.
The points are really well taken. I think there are certain, well, we don't know where fibroids come from, unfortunately, not yet, but when they arrive on the scene, it's clear that they grow with estrogen. That's why they get bigger when a woman gets pregnant, and why they typically are not an issue once a woman goes into menopause. And so we've kind of taken this anti-estrogenic approach when we see these patients. So you mentioned the first thing is we try to tell them about some of the hormone-rich foods and try to see if they can at least, limit them, if not, do a switcheroo, like the big ones you mentioned, like red meat, non-organic chicken, dairy. You can do the workaround with chicken and just get the organic chicken. Dairy, you can do almond milk or some of these other nut milks rather than cow. Beef, a little harder. Soy is kind of a mixed bag. Some of the soys are actually pretty good. They have phytoestrogens that can block the estrogen receptors. And so some of it's good. It's kind of a mixed bag, but so we go that route first. And then we also at the same time tell them, if you can decrease those estrogenic foods and increase the foods that kind of block estrogen. So colored fruits and vegetables, because they have flavonoids in them that block estrogen. That's a good, it's always good eating more fruits and vegetables and less red meat. So that kind of helps. You mentioned vitamin D. That's huge. I'm really surprised how many people we find that are very low in vitamin D in Atlanta, where you figure it's, I guess people are not outside even in a sunny area. It just goes to show the difficulty that women of color in my practice, it's harder to absorb, and men too, but I don't see men, I see women, where it's due to the pigmentation of the skin, it's just harder to get adequate vitamin D. And that's a really good anti-fibroid, it's actually a pro-hormone, but vitamin. And then the other thing that we like is green tea extract. There's pretty good data on that. So we try to get them to, if they like green tea, that's a good help too. So you kind of try to fire all those. And then the last thing is, we don't really know exactly why African-American women disproportionately suffer with fibroids, but because it runs in families genetically, we don't really understand the genetics, but estrogen is stored in fat. And so in general, African-American women have more body fat And Asian women have the lowest, and they have the lowest incidence of fibroids. So while we can't pick our parents, we try to get them exercising, losing weight. And so if they can shed the excess body fat, we've seen some pretty dramatic results on the kind of medical side before they get to me needing, you know, what I do through the UFE procedure that treats fibroids. We can, on the front end, help quite a bit. And I've seen some pretty significant, I'm surprised at how good the results can be.
Yeah, I mean, the flavonoids, like you mentioned, I think are like a huge thing. You know, really trying to get patients to eat vegetables with every meal and to make that like a practice and not, you know, like this special occasion thing, but half of their plate, which is my charge to my patients, half of your plate is vegetables every single meal. That's 3 meals a day. And you should have at least 3 different colors on your plate, because that ensures that you're getting kind of a more varied vitamin and nutrient profile, because it's hard to tell patients like, okay, make sure you get vitamin A, get vitamin C. But if you just say, listen, try to have at least 3 colors, you know that they're probably getting a diverse nutrient profile. And I mean, I you know, fibroids, like you said, they're so complex, and, you know, why some people get them and why some people don't. But I do strongly believe in a lot of the lifestyle things. I actually had to get an ultrasound for something maybe about a month ago. And the doctor told me I had a fibroid. I had no idea, because I have absolutely no symptoms. And I charge it really to my lifestyle. Yeah. The fact that it was extremely small. She's like, it's really not even worth mentioning. I was just letting you know, because I know you'd like to know. But I really think that it's because of the lifestyle stuff.
I'm sure that's what it is. I mean, 80% of African-American women, adult women, have fibroids. So it's really common. But as you've seen, you have a very good lifestyle as far as, you know, healthy eating and exercising and doing all the right things. And you've kept these fibroids, we call them passengers. They kind of ride along in the uterus. They don't bother the woman. The woman doesn't have to bother them. And that's fine. And likely that will carry you all the way to menopause. And then menopause, it's not an issue anymore. So I guess I'm like the dentist that's trying to, you know, keep people away from me, but that's really important. If you can do those things, likely you won't have to come to the mechanic when the car is broken and he fix it, or the surgeon, the gynecologist, to do surgery. And how great that would be. That would be wonderful. I mean, because it's not only great what you're doing for your fibroid health, it's also great for your cardiovascular health. You talked about your dad. There must be some genetic thing in, you know, as far as cardiovascular health, that you've got to kind of watch out for that, and you're doing all the right things.
Yeah, it makes a difference. And, you know, our health is our legacy. Our health is our legacy. And so I often tell my patients that you're not doomed by your genetics. You know, just because something happened to your mom or your dad doesn't mean it's doomed to happen to you. You have a say in this. And so it's up to you what you do with your lifestyle. But I try to really empower patients that you can be in control of your health. You can decide, and you can take the control and decide.
Absolutely. I mean, and, you know, with fibroids, again, it's the #1 reason why women have heavy periods, and these periods can be just absolutely awful.
Yeah.
Heavy, and they come into the office, they're profoundly anemic.
Yeah.
And so they're tired, they're weak. And it's very disabling from a physical standpoint,
Yes.
because of the anemia and all the things that go with that. But it's also mentally taxing to them.
Yeah.
In fact, I just wrote a piece recently for Rolling Out about hearing, you know, the experiences of my patients about keeping it moving. And this column that I write is like, "Dear fibroids, you know, I'm tired of getting up at night to pee because, you know, the fibroids are pressing on the bladder." Or, "Dear fibroids, I'm tired of bleeding so heavily." Or, "Dear fibroid." Well, this one was, "Dear fibroids, I'm tired of keeping it moving." And that's what a lot of my patients are doing. They're African-American women that are just keeping it moving. They're suffering really badly with fibroids, and not only physically, but mentally. And they're just they don't know about what I do. They don't know about UFE. All they know about is hysterectomy, and they don't want that, and I don't blame them. And so they just kind of suffer with these horrible periods and these horrible fibroids And what was really interesting to me and that I didn't really realize was, they're going to work and they're keeping it moving. They're just kind of putting their head down, and largely either, well, financially, they don't want to miss work, and I can understand that, but they felt a responsibility for other women. Like they may be the only woman in their law firm, let's say, or the only woman of color in wherever they work. And they felt this responsibility for someone that might come after them. It was something I never even comprehended. They were, they didn't want, because, if it was a male dominated workplace, men don't understand about periods. They don't understand about fibroids. And so these women are like, well, I got to just keep it moving. And because, the next person behind me, might have this issue, and I've got to like represent for them. Like I can't let people down. I'm blown away by that.
Yeah, I mean, I think a lot of Black women carry that on their shoulders. It's similar, it's similar even to, reproduction and infertility and, similar conversations where things like fibroids and getting those addressed, it's almost like a luxury. That's almost like a luxury item for Black women, right? Like we're out here just trying not to die. We're just out here trying not to die. So you're telling me, something that I can manage, even though like it sucks, like for 2 weeks out of the month, for some people, they're not even functional, and for some people that's just, they're functioning, but they're miserable. But to some women, they feel like since I'm able to do it, I'll do it, because I can, not knowing that they don't have to suffer. I can't tell you the number of women that I've just been doing a well exam. They don't complain to me about their periods. They don't complain to me about any abdominal pain. And I do their abdominal exam and I feel their uterus at their umbilical. I feel it at their belly button. Right. And I say, have you felt this? Do you feel this hardness? And they say, yeah, I feel it sometimes. Sometimes it hurts, like especially when I try to lay on my stomach at night to sleep. And I said, how long I have had so many women. So even when I hear that 80%, I know that that's extremely underreported because there's so many women who suffer that don't know that they don't have to suffer, that it's even a thing.
Yeah, it's incredible. There's so many women that, what I do is called uterine fibroid embolization. For those that are not familiar with it, it's a completely non-surgical outpatient procedure that treats every fibroid in the uterus. It has a very high success rate, over 90%. Patients come into our center, they leave the same day with a Band-Aid. It treats all the fibroids in the uterus, knocks them out. We just basically, with a catheter, get into the blood supply, supplying these fibroids, and knock out the blood supply. So the fibroids will die without a blood supply. The uterus stays alive, and I've had numerous children after UFE, but the fibroids all die, and as they die, they kind of shrivel up, they soften and shrink, and then a woman's symptoms go away. I mean, it's one of the biggest medical breakthroughs for women, and I've been doing it here in Atlanta for the past 25 years, yet relatively speaking, nobody knows about it. And it's a real shame because we could literally replace all the hysterectomy for fibroids that's being done. And that's the number one reason why women get hysterectomy is benign fibroids, not cancer, which would be appropriate. So we're doing all this unnecessary surgery to treat benign disease, and it could be easily replaced by UFE. So we're out in the community constantly talking about UFE, but it's something that we could end the suffering for a lot of women because they could get back and they wouldn't have to keep it moving. That was, I was so struck by that, well, we can help you. You're only down for a few days and you're back to work quickly. You go home with a Band-Aid. And yet there are these women that are just like, I'm just going to keep my head down. I know I don't want hysterectomy, and they're not being told of anything else. So they just put their head down and keep it moving.
Yeah, that's amazing.
Well, how about as far as, are you involved in any of the medical schools? Because I mean, I think the medical school curriculum is a really good place where we should be trying to get this kind of, nutritional preventative stuff on the front end of things. I mean, I volunteer at Morehouse, and that would be a great place, or obviously Emory too. I mean, are you talking to students or residents, or are you in the kind of medical school curriculum at all?
Trying to be more on a formal basis, but I do things. I have a lecture tomorrow with Spelman pre-med students, but it is something that needs to be more part of our medical school curriculum and residency as well, because it affects no matter what specialty you go into. If you're an orthopedic surgeon, you still want a metabolically healthy patient who's going to give you a good surgical outcome. So no matter what the specialty, your food and your nutritional status is going to affect all parts of your health.
Absolutely.
So, yeah.
How about as far as shadowing opportunities? Are there opportunities to shadow you, or?
Yeah, I have students. I've had med students, pre-med students come and shadow me for sure.
Awesome. I mean, because that's I mean, I think mentorship is really important, and if you can address some of these things, you know, during their training, they can kind of, to be it, they got to see it.
That's true.
There could be a whole wave of culinary doctors coming. That would be awesome.
That would be awesome.
I was looking to see if there are any usually there's people, you know, having questions and trying to see about the Q&A here. There's not anybody questions. I was hoping there was going to be some questions, because that usually generates a lot of really interesting discussion, but if there's not, that's fine. I'm gonna give you the rapid fire here. So while we're waiting, see if there's any questions. So I'm gonna give you a choice of this or that. I want to just kind of see, like, fruit smoothie or veggie smoothie?
I can't have both?
No, you gotta choose.
Then I would go with the veggie smoothie.
Veggie smoothie. Yoga, meditation.
Meditation.
Instagram, Facebook.
Instagram.
Prince, Michael Jackson.
Michael Jackson.
Falcons, Lions.
Lions.
Oh, you are from the Motor City.
I am.
Wow, those allegiances, they die
They
hard.
run deep. They run deep.
Awesome. Well, and any other things that you want to mention about kind of what you're doing, and that we can talk about? And we have a few extra minutes.
Well, you know, if any, you know, women want to work with me more closely in regards to like their food, you can follow me on Instagram. I have a membership, like I talked about. It's called Cooking Queens, because I believe that all women have a queen in us. I believe in, you know, to really make change in a community, you start with women. So that's why I focus so much on women. And so if you're interested in my membership, which has been just amazing, we talk about so many things with regard to food and health, food and breast cancer, food and inflammation, food in our immune system, food in our gut health. We talk about just everything, mental health, everything as it relates to food, all the conversations that I feel like I don't get enough time to have in the doctor's office. This is where all those conversations are having. And we're doing virtual cooking classes once a month. And it's just a great sense of community, which is something I think that we all need more of these days. So cookingqueens.com is a place if you want to learn more about that.
Oh, great. I did get a question now. There's regarding, is the full panel blood work necessary annually? Signs of diabetes, heart disease, etc.
Yeah, I would definitely get it once a year. If I have patients where stuff is abnormal, I'm repeating it more than once a year, because you don't want to wait a whole year to see how things are going or to see if things need to be changed. And I also think it's, again, nice when you can have objective data that changes. I think it's always, you know, just a good positive reinforcement. So I'm very kind of aggressive with my blood work.
Excellent. Anything in specific you want to mention about, you said where can they reach you as far as your Facebook, your Instagram, your kind of website? Make sure that you list those things again.
Sure. So I'm on Facebook, Instagram, LinkedIn, all at Dr. Lauren Powell. That's DrLaurenPowell. My website is drlaurenpowell.com. I like to hang out there too. That's a great way for us to stay connected. I send out, you know, subscribe on my website. I send out like weekly newsletters with recipes and things like that. So that's a great place to connect as well.
Excellent. Got another question. Are there any foods that I can eat that will prevent or reduce fibroids? I think we talked about that a little bit, but
yeah, so yeah, a lot of the things that we talked about, I think, you know, eliminating the red meat, reducing, if not eliminating, the alcohol. If you're going to drink alcohol, I prefer things like red wine that offer a health benefit. And I try to get my patients to stay away from beer, which has been shown to have a positive correlation with fibroids. Increasing those vegetables, those green leafy vegetables, all the colors. I tell my patients eat the rainbow. Just try to really diversify your diet. I say half the plate. I use the plate rule. So I say half your plate should be vegetables, and you can take the other half and divide that in half. And so you have a quarter of the plate that you can use for your carbohydrates. I say no white stuff, no white rice, no white potato, white pasta, white sauces. I say no white stuff. And then a quarter of the other side is a lean protein. I love fish. I love the fatty fish. Ground turkey is great as well, and things like that.
Yeah, we have a number of people in the office actually are doing the Whole30. I don't know if it's kind of like a paleo, I think, but it seems to be stricter. I mean, I don't know. It's not something I subscribe to. If I'm doing a diet, it's the seafood, like you see food and you eat it. So, I mean, but they're doing this Whole30 where it's pretty strict. Any words on that diet?
Yeah, so I don't recommend any specific diets. I try to instead give principles, because I notice that if you give a diet, specifically ones that are very restrictive, people can only do that for so long. They're not able to maintain that.
Right.
And so what happens is they do great, and then they go back to the way that they were eating before. And so since we want to make lifestyle changes, anytime my patients tell me something they're going to do, I'm going to do this, you know, fast, or I'm going to do this diet. And I say, okay, well, how long are we going to do it for? And they say, I'm going to do it for 4 weeks. And then I say, and then what? And they're like, then I'm going to go back to regular. Well, no, I don't want you to do anything that you can't maintain for your whole life. So if it's not a whole life thing, we're trying to make lifestyle changes, not 30-day changes. So I don't kind of go with specific diets. I kind of go more with principles that I feel like are more sustainable.
Yeah, it makes a lot of sense. And come to think of it, I think I saw you make a pumpkin smoothie it's about that time. We're almost to Halloween. I mean,
it is. I gotta bring that back.
Are you gonna make any more of those?
I love those. Yeah. Pumpkins are great because they're very low calorie. And then it has lots of it has like vitamin A, vitamin E, vitamin K, some vitamin C. It has a little bit of fiber. And so I love pumpkin.
Yeah, it was like, I think there was like a little bit of vanilla in there. I was trying to.
Yeah, I think I used a little bit of almond milk, a little bit of vanilla extract. I use dates to sweeten them. I try to stick with things that are all low glycemic index, so things that won't raise your blood sugar a lot. So I like to use dates to sweeten. And that's basically it. And I think I added a banana too. Half a banana.
Dr. Lauren, you said you like meditation over yoga. Would you also suggest meditation over yoga to your patient? If so, why? Does it help reduce fibroids?
No, it's whatever.
Fun.
Yeah, it's whatever stress management works for you. I really like meditation. I think it's something easy to do, and I think you can do it wherever you are. So, I mean, I've meditated, just sitting, waiting for a doctor's appointment, just kind of closing my eyes and, kind of relaxing. I do it every night. I do also do yoga. I love yoga. I love Pilates. I love bar. I love anything that's stretching too. So I think you should do both, but he made me pick one.
I agree. I mean, I try to find a few minutes every day, just kind of, usually it's around the lunchtime for about 5 minutes, the meditation really does kind of refocus you, I think it's really helpful if you can just take a little time away and get to a quiet place and just, kind of let things go a little bit. And yoga is really helpful. I mean, I'm one of the least flexible people. And so I found anytime I do yoga, it certainly does help.
Yeah.
I think I wish I could do it actually more. I've really enjoyed the times that I do it. I don't do it often enough, but it does definitely stretch you out, and it's relaxing. I'm impressed by people that can really that are very flexible. I'm jealous about that, but I need to work on it. Definitely.
It's definitely a practice.
I'm not sure about anything as far as meditation and yoga and fibroids per se, but I think all these things that we've talked about are just if you can make some of these lifestyle changes, it invariably is going to make your whole health outlook better. I mean, and for women, since my practice is entirely women, and women, even in my household, run the family and the family's health. And so when mom is not feeling well, the whole family suffers. So it's really incumbent. I mean, it's important for everybody, but I think it's super important for women, because they have more responsibility on them. You know, they have the whole family's health. And it's just so important that she is healthy and is doing the right things and kind of setting the standard really for the rest of the family.
Yeah.
Well, I really appreciate the time you spent, and I hope this was helpful for people that chimed in, and we had some questions, and I hope there were a lot of people that will reach out to you, and because I'm really impressed with what I saw you were doing, and I'm glad you came on, because we need more of this. We need more on the preventive side. There's so much of, you know, wait till it's broke and then try to fix it, and it would be so much better for so many people if we could really kind of bend the curve and get on the preventive side first. And really, that would really make some big impacts on general health. And that would be great if we could do that. And so I appreciate you coming on and taking the time to explain some of those principles to people, because I'm sure they got a benefit from that.
Well, thank you so much for having me, and I'm thankful for all the work that you're doing in the community.
Well, thanks. And hopefully we'll get you back on again here if we can keep this going with Rolling Out. And so I want to thank Rolling Out also for providing this platform to talk about fibroids, to talk about health and nutrition and all these other topics that are really important. And hopefully it's people will enjoy watching this and take it to heart, and hopefully they'll come see you, because it would be great.
Yep, sounds amazing. Thank you so much.
Have a great evening.
Evening.
Thank you. You too.